Hello guys and welcome to Meddy Simplified. So today I'm here to talk about integrated learning or integrated approach to study medicine. So what is integrated learning? Why it is a hot topic of discussion or a so common discussion so that I am making a video about it. Without wasting a lot of time, let's talk about it. So just go to a flashback. You're in your first year of your MBBS, right? First prof of your MBBS. You start learning about anatomy and physiology, normal anatomy and physiology. You are studying about the abdomen, the visceral, the organs inside. You came across the normal anatomy and histology of stomach and esophagus. Then you, in the same year, you start learning the physiology, and when you reach the GIT, you learn the normal physiological function or the normal functioning of your GIT. That is, commonly we learn about the stomach and esophagus. Then you passed your first prof, you came in your second prof, and then you started learning about a bit bigger subject, that is pathology, pharmacology and microbiology. So when you are studying pathology and when you were studying general pathology, you came across a topic that is neoplasia. In neoplasia, you learn about metaplasia and came across the thing that is Barrett's esophagus. Then similarly, in the same pathology, you were studying about the ulcerations in the stomach and duodenum, and you came across the disease that is called as peptic ulcer disease. In the same year, when you're learning pharmacology, you came across the term PPIs, that is proton pump inhibitors, in the GIT, which is a treatment for the peptic ulcer disease, which you learn in pathology. Then after getting this base, you came in your final year, and in your final year, when you were studying about GIT medicine of GIT, you started learning about the clinical features of the peptic ulcer disease or Barrett's esophagus also. And you learn the clinical investigations needed to be done to confirm the diagnosis as a peptic ulcer disease or Barrett's esophagus. You learn the prognosis of the disease and everything else needed to become a good clinician or a good practitioner, right? Similarly, in the same final year, you came across a term argon photocoagulation, which is done to treat Barrett's esophagus, right? A surgical procedure. Or you learn about esophagectomy, that is removing the part of esophagus which has been affected by a carcinoma, right? So in this way, from the first prof till the last prof, you study a same topic from the base till the end to become a good clinician. In this way, a system-wise approach or a topic-wise approach to learn a subject or a disease, right, from the first year till your final year, right, and linking them together, this is known as integrated learning or integrated approach to study. So the next thing is why there is so much buzz, or it is a hot topic of discussion. If you have recently followed any exam or you have solved any previous year questions, right, the recent, right, 2019 or 20, you might have seen many clinical approach questions are being asked. So to tackle these clinical approach questions, this integrated learning has proven a very good option to tackle those clinical approach questions. So that is why it is a very hot topic of discussion and we have discussed it. If you have ever watched my videos regarding strategies, which are very few but they are there in this channel, so I have always emphasized that you should learn physio, patho, pharma in a system-wise approach, so that the medicine which is the final year subjects becomes a cakewalk for you. If you have not watched any of my videos, do watch it and comment down that how useful it is. So the question comes, how to study in an integrated way? Well, if you are doing it for the first time, I'll prefer you that I keep on saying, many people try to start integrated learning from this 3 P's, that is physio, patho, pharma. Suppose if you are doing it for the first time, go to physiology, learn the normal blood physiology, then study hematology from the pathology, and then learn the drugs related to hematology. And if you find it useful, try it, and if you find it useful, do share your views in the comments down below. Then next thing is that this clinical approach or this clinical type of questions being asked nowadays, is there any need to learn the factual questions? A clear-cut answer is yes, because the most commons remains the same, or it keeps, even if it keeps changing, they will ask you in a different way. So, or the staging of any disease or the normal values, it will have the same impact or same importance in any exam, even if the exam turns clinical. So yes, you will have to mug up these factual things. Next thing is, if you have learned any topic in a systemic way, so how will you practice the questions? What is the source to practice any question? So the answer is the custom module options, which is now been provided by each and every apps, right? So what you need to do, you will go, you suppose you studied GIT, which we discussed just now. Suppose you studied GIT in a systemic way. So first of all, go and select all subjects. Then in each subject, select the topics related to GIT. In anatomy, click the topic as abdomen. In physiology, GIT. In patho, GIT. In the same way till the last subject. ENT of the obviously will not do any GIT, so you'll skip that subject. So in this way, try to create a module related to questions according to the topic you have studied, the integrated way, and then try to solve this question. And trust me, this integrated way of learning along with this custom module will prove a game changer in the upcoming next exam. So thanks for watching this video. Hope you find it useful. If you find it useful, do share your views in the comment, and do not forget to like, share and subscribe my channel Meddy Simplified.